In the recent debate over the construction of a new hospital or medical complex to accommodate the island's future health needs, it's not been a question of if, but of where. But there's yet another question that might be more urgent. It's when. That's because the Army Corps of Engineers has determined the current GMH has only a handful of years left. One answer could be this medical arts center located right next to the Guam Regional Medical City. Attorney Cesar Cabot is the developer.
Regardless of where the government decides to build its next municipal hospital, the fact remains that it's going to take some time. It may take upwards of 5 to 10 years in order to complete. So we wanted to be in that space in the middle to be considered the interim 5 to 10 year solution while Guam decides where to build its next hospital.
It's been well reported that the Leon Guerrero administration favors developing a full-scale medical complex in Barrigada, while prominent members of the medical community believe only a new hospital is needed and the old GMH site at Ypao Point makes more sense. Cabot says the Medical Arts Center is available for the here and now. It's ready-made for an interim medical facility, he says, that can be specifically retrofitted within 6 months to a year.
You have all the medical infrastructure in order to build a small hospital or a post-acute care medical facility, which is what it is intended to be. This is not a commercial building trying to pretend to be a clinic. This was actually designed and built to be a small hospital, a post-acute medical facility for healthcare.
He says a private mainland company that operates some 70 acute care facilities has been looking into the potential of operating the Medical Arts Center and has signed a letter of interest. But Cabot has since been approached about the possibilities of a public-private partnership to operate the MAC as an interim hospital.
Well, that's a new concept that was shared with us by Senator Jesse Lujan and Senator Chris Dueñas. So we haven't worked out all the details. But what I've heard from them is possibly there might be this private-public partnership where a private enterprise who operates 70 hospitals in the United States possibly may find it feasible in order to operate the Guam facility at no cost to Guam, if Guam builds it and if Guam can ensure a certain level of insurable patients.
If you were to try and convince the hospital leadership and then ultimately the governor to use this property, what would you say?
I would say that the governor gets to decide. The legislature gets to weigh in. We just want to put our hand up and say, Guam, you have options. And we'll let the decision makers, the powers that be, decide the course of our island.
Nestor Lecanto, KUAM News.